Joining me now is Dr. Peter McCullough. He is the founder of the wellness company. He's batting 1,000. Everything he's been saying for all this time has been right. He hasn't been wrong on anything. And I was such a believer in him. And he was the first one to put himself out there about these vaccines and everything else and saying it was all nonsense. And here we are. Once again, Dr. Peter McCullough with us. Dr. McCullough, great idea. Thanks for being with us.
Thank you.
So, listen, I'm thrilled with a couple of choices that affect your world that you have great expertise in. Number one, let's get to Robert F. Kennedy Jr. as being basically in charge of Health and Human Services. And how do you view that pick, Dr. McCullough? And how is he going to affect the medical community?
He will be very well received by the medical community. I mean, think about, we've had Alex Azar and then Javier Becerra. They were autocrats. They didn't show any significant leadership. The HHS is a huge department, for a cabinet position. Think about it. Over a dozen sub-agencies report to HHS. So Kennedy will hold a huge cabinet position that will influence Americans. And, broadly across the country, because Medicare, Medicaid roll up into it. Kennedy is not bashful. He's evidence-based. He'll drive consensus from all the stakeholders. And he will make America healthy again through really good public health policy.
And so why do so many doctors, why have they risen up in opposition of RFK Jr.?
It's a small number now. There's 1 million doctors in the United States. I believe there's a few thousand who have signed a petition. And they may, 98% of doctors are Democratic. And that's kind of interesting. Kennedy's originally a Democrat, now in a Republican administration. But I think it's a small group of dissident doctors. I think broadly the medical community, which includes hospital administrators, researchers, they will broadly accept Kennedy because I think he's going to restore normal processes to Washington, kind of bring in the various stakeholders to get a consensus on issue and drive public health policy. One of the first things I hope that is addressed is to ban gain-of-function research in biolabs in the United States. A former White House coronavirus czar, Ashish Jha, was at my alma mater, University of Michigan School of Public Health, and he told the audience there that there are biolabs all over creating the next types of COVID viruses to get us all sick. And he said that in his speech.
It's just crazy what is going on. Are we ever going to get to the bottom of these vaccines, in your view?
I think we will. We'll have to work through them. The COVID-19 vaccine will be first up. And, when the critical meetings are held, all the stakeholders will need to be there. I'm talking about the CDC, FDA, NIH, HHS, the vaccine companies, academia, will all need to be there and see the safety data together so no one can say they didn't know. And then the decision will need to happen to pull these from the market.
Dr. McCullough, also yesterday, Dr. Mehmet Oz named as head of the Social Security Administration, which basically oversees Medicare and Medicaid. And that administrator at that role is basically, it has the same responsibility of a cabinet position, but it's not in the cabinet. So he'll be under HHS. We're working with RFK Jr. Everyone knows I'm a great personal friend of Dr. Mehmet Oz. What did you think of that pick by President Trump?
It's an excellent pick. He's going to replace a very junior administrator right now who's not even a doctor. She's very ineffective, looked like a DEI choice, to be quite honest with you. Mehmet Oz has participated with Medicare and Medicaid, as I did, for decades. He knows the system well. He knows the medical issues. If anybody is going to restore some fiscal responsibility to healthcare, it's going to be Mehmet Oz. I know him personally, and I think, again, the healthcare community will get behind a strong physician leader to lead these two huge programs.
RFK Jr. is determined to break up Big Pharma, this kind of ironclad, this iron triangle of Big Pharma, big money, big politics that is driving everything. And you watch TV, you see all these ads they have on, and 3/4 of the ad are disclaimers. I mean, it's just gross. What do you see happening in Big Pharma now? Do you see a shakeout? Do you see RFK making a difference? What will happen?
I see direct-to-consumer advertising by Big Pharma gone, like it is in almost every other country outside of New Zealand. We shouldn't have the CDC advertise vaccines on behalf of the companies. That should be gone. I think the public now will go to their doctors in their healthcare environments where they receive their healthcare, and then have a fair discussion on treatment options, not be bombarded by unfair, biased Big Pharma commercials. People pay the price for these inexpensive drugs. So getting rid of pharmaceutical advertising will, I think, be a welcome move by the medical community and the public at large.
So going forward, when you look at a company that, like yours, that you've developed, the wellness company, how does this affect it? How does this affect companies like yours that are really competing with Big Pharma, big pharmacies, and everything else? How do you guys fit into this mix?
Well, the wellness company has a huge customer base now, John. So we directly communicate with our customers. They have, email newsletters, health education, nutraceuticals and supplements. They now have free prescription drugs, free supplements through the membership programs. The One Wellness Elite program is just amazing, less than $100 a month, and really free prescription drugs and supplements, free telemedicine. And so as the wellness company continues to grow, it is an option for people to consider as supplemental in addition to their healthcare insurance, which is becoming more and more just catastrophic, kind of high deductible insurance or health sharing plans. And importantly, I think it's a necessity for those who are uninsured right now. So wellness company will thrive under this new administration.
How effective do you think RFK Jr. is going to be in eradicating some of the additives in basic food that we have? He's been very skeptical for a long time on fluoride in water. A lot of the products that are made, that are sold in Europe, they have to take these additives out because they're illegal there. Kind of sum that up for us, Dr. McCullough.
Quickly, he'll get trans fats out of the food supply. The American Heart Association has wanted to do this since 2009. The WHO wants to see this happen. Bloomberg in New York City did it, and heart attack rates dropped. So I think trans fats gone out of the food supply quickly. These unnecessary food dyes that have potential health hazards, again, that can literally happen through a series of executive actions. And then fluoride and aluminum in the water both have concerns regarding cognitive function over time. He'll need to bring in the relative stakeholders at this point in time. Improved water purity for both tap water and bottled water, can be a high goal to achieve. Many believe we don't need to add anything to the water. We just need to make sure it's clean. And President Trump said that he wants clean, pristine water. And I think Kennedy will deliver that.
I do too. I really look forward. I think the combination of RFK Jr. and Dr. Mehmet Oz, I think we're going to see a lot of changes, and all for the good. And this whole thing, make America healthy again. We hadn't really thought about it, but now that we're focused on it, I really think that we're onto something. But look, the wellness company was your vision. You're the founder. You've been on the cutting edge of this. And I got to tell you, I say this a lot. I've got right here, I got 3 of these, the medical emergency kit. Now, Doc, get this. My doctor assigned to me is Dr. Bradford. Great guy. When he's off, I get Dr. Kelly Victory. But the amazing thing is we have 3 of these. And we have utilized your emergency medical kit in my family in 11 months, 12 times. I've replenished it 2 times. So I don't know if we're getting sick all the time, what's going on. But between the 3 of us, I mean, I just took it again the other day. I had a bad cold and whatever was going on, and I got to come in and do, 2 hours of TV like I am now. And I just unzip this thing, get my ivermectin out. I'm good to go. And but utilizing this, think about this, folks. 12 times in 11 months, I just unzip it. I got 3 of them. Unzip it. The stuff is there. Talk to Dr. Bradford. This is like the greatest thing out there. And so you get to take kind of the things into your own hands. You don't have to wait online, go to any of the docs in the box with all these illegals in it. All you got to do is subscribe or just buy one of these. You get 10% off with Godzilla. Go to twc.health/Godzilla, twc.health/Godzilla, promo code Godzilla. You're going to get 10% off. And every family should have one of these medical emergency kits. We've got 3 of them. But think about this, Doc. 12 times in 11 months we've used this. And a big shout out to Dr. Kelly Victory, Dr. Bradford, Dr. Peter McCullough. Always an honor to have you on. You're a true visionary. twc.health/Godzilla. Promo code Godzilla, 10% off. We'll see you tomorrow. America Sunrise right now.